Hey there, it's Lowell Wild Jr. Recently, I've been getting a lot of questions about what is the most profitable services that I can provide in my clinic. And my initial reaction is to say, why are we thinking about profitable services? We should be thinking first and foremost about patient care. It doesn't matter what is profitable and what is not profitable. We should first think about patient care. And then I started to think about, okay, if we're first going to start with patient care, let's talk about some of the things that we do that are appropriate patient care and then look at the profitability associated with them. So again, we must always lead with what is best for the patient. But let me give you some thoughts. I commonly see people not understanding E&M coding. They do not understand the CMS guidelines on how to properly bill and the E&M codes. And understanding the rules and the regulations about it will likely get your office visits to a more appropriate level, which often is getting you to a higher level of E&M coding. So understanding the rules, and frankly, if you look at the APMA guidelines and the CMS guidelines, most of us as podiatrists are in the 4-level care most of the time. Certainly we're in the 3s and we might be in the 5s and occasionally but rarely in the 2s. And if you understand the rules, it's going to increase the value of the care you are providing. Not changing the care you're providing, just increasing the value of the care you're providing. I also am looking regularly at comprehensive care. If somebody comes in with problems that need DME, if they need injections, I'm making sure that I am providing that care when they need it. I don't do one thing at a time and drag out care for people. I tend to be very comprehensive, and patients continue to come back to me and say, thank you for being comprehensive, or using words similar, because I got better faster versus my friend that went to this doctor and it took much longer to get to the end point. When it comes to injections, you should always be using ultrasound guidance. There is so much evidence-based literature that shows that ultrasound guidance provides better outcomes, and of course you're going to get paid more for providing more comprehensive and more complete care by using ultrasound guidance. And a lot of people say to me, I don't have time to use ultrasound, I'm so busy. And I say, if an ultrasound is, how long does it take you to do an ultrasound? 5 minutes? If you get $50 more for 5 minutes of care, isn't it worth it? And ultimately, it is better care for the patient. So looking at that type of a thing. And of course, I love to use things like shockwave treatment, injection therapy, like regenerative injections, amniotic injections. Those things are good care, and they often will increase profitability. If you're a wound care person, understanding grafts, using grafts when appropriate and using them in the right way, understanding the guidelines, making sure you're doing all of the things you need to do with documentation, but grafts help patients get better. The research is clear and there's a good profit margin associated with it. So when you start to think about how to make more profitable care, it's looking at the right care and then using the right care in the most proper and profitable way, and that can help you get where you are looking for to increase the revenue, profitability of your clinic, your practice, and ultimately create a better situation for you, your employees, and your family. Have a great week.